Hey guys, I think I was cut off at that last moment when I was speaking about having, manipulatives in our counseling or in our crisis response rooms. And so I began talking about, having Play-Doh and other things in there that can help keep students' hands busy. Not only is it very therapeutic, but oftentimes, it can distract them from, maybe some extraneous energies and emotions, and it can help them open up quite a bit. So, kind of like we fidget in class sometimes in order to be able to focus better. That's kind of like how that works. You always want to ask the person what the person is experiencing. With any student dealing, who you need to attempt to stabilize, you want to, question them about, hey, what's going on in that head? And I wouldn't ever say, are you okay? But I might say, what's happening in that noggin? And they will let you know if there are things happening like flashbacks, or if it's been a day already, dreams that they might be experiencing. So as you gather that information, you want to jot it down so you don't forget, so you can go back and reference during your conversation. Also important with any student who's coming in, the reason they're coming to you is because they have compromised emotions. We want to help the student address their concerns, not telling them something like, hey, you need to calm down, or hey, you should feel safe right now, or even something like, everything's going to be okay, or hey, I understand what's going on here. No, you really don't. You don't understand what's going on in their head, okay? But we're there to address what they're dealing with, and so it's best to ask questions. Tell me about what you're feeling right now, because I know it's not what I'm feeling right now. You also want to give information that orients the survivor to their surroundings. Okay, so you might say, hey, if the kid's freaking out, you might ask them to name a few things around the room, and we'll go over that in more detail in a little bit, so that they become grounded in the situation. You might talk to them about the event. We have a district protocol that we follow where we share as much information as given to us by our administration so that we don't communicate incorrect information and fuel, any sort of rumors. So we want to provide them with information. And when we do provide them with that just right amount of information, their fear levels drop. Because guess what? We're afraid of the unknown. We're afraid of not knowing the story. And it's not just about students and getting as much of the good stuff, the gooey rumors as possible. Truly, when kids are affected negatively by crises, they want to know. They want to know, just like we want to make sense of the stuff we see in the news. You know, I often ask myself, when really, really bad things go on here, in our United States, and tragedies occur, when school shootings happen and things like that, I often ask myself, gosh, I really want to know what the background is. And sometimes, I'll lose sleep over it. I want to know, well, what, does this person have a mental disorder? What is happening? What are the details of this? Because I'm curious. Because I picture my own kids in those schools where those shootings happen, and so my fear levels are brought down just knowing the right amount of information. And sometimes it's not enough that we can provide, right, in order to protect our own kids, but we give them that information when it's reasonable nonetheless. And then offering steps for them to follow to consider. You want to convey a sense of hope. You never want to, if they're very, negative thinking, you want to hear them out. You want to listen to them. You want to say, this is what I'm hearing you say, but let me tell you, this, we can help this. We can move forward with this. We can. I know we can. I hear where you're at, and this is going to be tough, but we can make it happen. We can work together. And that conveys a true sense of hope, which even if you don't feel like they're buying it right away, in some ways they are, and you're chipping away, kind of like the cracks in a wall that begin to connect. And then finally, offering support on specific manageable feelings, thoughts, and reactions. So, as a minister, you are very familiar with human emotion. You're very familiar with the positives and negatives that apparently come along with a wide range of emotions. And so we want to offer support on those feelings, on those thoughts and reactions. We want to use our knowledge to help intervene with those in positive ways so that we don't demean the student, but we help support them to get to a level of functioning that is reasonable, so that ultimately down the road there can be closure. We cannot get to that closure unless we begin to process what has just occurred and how it affects us and our loved ones. When we begin to discuss highly overwhelmed students, it is important to consider that most students will not require intensive stabilization. Okay? I would say that, 3 out of 20 that I'll work with in any given crisis situation do require intensive stabilization techniques, where we're working to calm, or we're working to ground them. The rest, which are the majority of whom you'll be dealing with, are not. They don't require that much. Moderate amounts to light amounts. So, what does freaking out look like? It is defined as intense, persistent reactions that interfere with effective decision-making and or functioning. Intense, that's to a notable degree when compared to their peers. Those top 3, those fringe, they're freaking out. And when you compare them to the rest of their peers, they stick out, don't they? Persistent, okay? I'm not talking about, okay, I'm having highs and I'm having lows. I'm having highs and lows. That's not, inconsistency. That is persistent, okay? So if they're coming in and, they're having a really, really rough time, but then they're able to calm down and they're having another really rough time, that kind of repetitive pattern is a persistent pattern. And then also the interference with their reasoning and functioning, okay? The only way we can make effective decisions is if we're thinking reasonably. Well, when we're in a heightened fear state, we're not reasoning. We're thinking about what might happen in the future, and we're thinking about what just happened in the past. Those are things that we cannot change. The only times when we're thinking reasonably are when we're in the moment, focusing on what we're feeling right then and there, especially in a crisis situation. And that's what our goal is for these students. So physical signs of highly overwhelmed. The reason we're looking at physical signs is because, when I'm doing like a functional behavior assessment for special ed for a kiddo who, has big-time behavioral difficulties in the classroom, I have to operationally define what their behaviors are. So we're talking about the signs because we want to get down to the specifics of what it looks like. Otherwise, we're not doing our due diligence, and we can't record anything in our notes that's of value because we're not paying attention to the signs. So they may look glassy-eyed, vacant, or lost. They may appear unresponsive to verbal questions or demands. They may appear disoriented, so walking aimlessly or confused behavior. Very rarely when they're displaying this, are they just trying to create a farce, although it has happened from time to time. These disoriented individuals are far and few between, less than 1% of the students you'll work with. Uncontrollable crying, hyperventilating, rocking, or aggressive behavior, probably seen more often than disoriented. Uncontrollable physical reactions, shaking, trembling. Again, 1% of the population max will be displaying these sort of symptoms. Frantic searching behaviors. Feeling incapacitated by worry or anxiety. Now this one, depending on the situation, the closeness of the individuals you're working with to the tragedy itself, they may feel like they're so overwhelmed that they can't take the next step forward. Then our job at that point would be not only to help to mitigate their worry and anxiety by talking and considering the situation with them and processing it, but also to help them move forward with baby steps. We have to have reasonable expectations. We can't expect them to get where we are out of nowhere. And then finally, engaging in risky or dangerous behavior. So we've had situations in the past where students who are already at risk, a friend of theirs, dies tragically, and what do they move to? They move to those same risky or dangerous behaviors they were engaging in before, but they're upping it quite a bit. They're missing school. They may be using. There may be a variety of factors that are at play here, and our job is to identify and have conversations. You'd be surprised at how many high school students will share with you the behaviors that they have regarding risky or dangerous things like drugs, alcohol, sex, and so you want to identify that, record it, and then help address it in a way that doesn't shut the student down.